A cochlear implant system helps to restore the sense of hearing for individuals with severe to profound hearing loss. Cochlear implants bypass damaged portions of the ear and directly stimulate the auditory nerve. Signals generated by the implant are sent to the auditory nerve and then to the brain, which recognizes the signals as a sound. The main difference between a cochlear implant and a hearing aid is that cochlear implants are surgically implanted under the skin behind the ear instead of being removable. Children with hearing loss as young as 12 months old may be eligible for a cochlear implant. Experts recommend getting one as early as possible to expose children to sounds during the critical period of language acquisition. Adults may qualify for a cochlear implant regardless of whether they lost their hearing before or after learning language. Those adults who developed language before losing their hearing typically have greater success with cochlear implants than those who had not developed language before losing their hearing. The pros of cochlear implants is that you have hearing improvement, speech development, future learning and career opportunities, and the most important benefit of a cochlear implant is the ability to hear potential dangers or alerts such as sirens or other important sounds. But cochlear implants also have some cons. The cons are you have to get surgery, and with any surgical procedure you can have risk and complications. It can get pretty expensive, and they also require a lot of maintenance, such as battery charging and fixing wires. Although cochlear implants can really benefit someone's life, some people will still turn them down. The reason many deaf people turn down the cochlear implant is because people in the deaf community don't want to be quote-unquote fixed to become more like hearing people. Some feel that implants represent a loss for deaf culture. The deaf culture is the set of social beliefs, behaviors, history, and values of communities that are influenced by deafness, and they use sign languages as the main means of communication. Members of the deaf community tend to view deafness as a difference in human experience rather than a disability or disease. Many members take pride in their deaf identity, and unlike other cultures, a deaf person can join the community later in life rather than needing to be born into it. But since more than 90% of deaf children are born into hearing parents, these parents are stuck in the middle of an argument. The argument is, should children be fitted for hearing aids and taught to speak, or should they just use sign language, or a combination of both? This argument will never be resolved, so the best answer is to make the best decision that would benefit your child the most. But the parents who do decide to give their child the opportunity to get a cochlear implant can make this child very happy. These children will have the benefits of being able to understand speech, use a telephone, have conversation with their friends and families, and listen to music and be able to enjoy their sound of life.